if you're 65 or older and or disabled, I can probably save you a little money on your Medicare premium. I have, like I've told you, or like I've said before in the videos, I worked for social services for many, many years. And so I would just like to share some knowledge to kind of help you save a little money along the way if we can here. All right, so let's just go ahead and get right into it. If you're 65 or older, then you receive Medicare. And what Medicare does, there's there's actually 4 parts to Medicare. You have A and B, which is your hospital and your physician. And then you have C, which is an Advantage plan. And then you have D, which is your drug plan. Okay, for that plan, you're going to pay a certain premium every month. And right now, I believe the premium is around $187 a month. You know, that's a lot of money for people on limited income. And so if you just have regular Medicare, A and B, then you're going to be paying a deductible before it's going to pay anything. And the deductible, I think right now is like $257 a year or something like that. And then after you meet your deductible, which we all know that ain't going to take long with medical expenses, but once you meet the deductible, then you're going to be paying 20% of what your medical costs are. So, and we all know how, expensive that can get, and we all worry about it. I mean, it's something to worry about, because if you have a $20,000 medical bill, then 20% of that is going to be $4,000. That's a lot of money for us to come up with. And so anyway, I want to just get right into it and kind of give you a little bit of what I have learned over the years working in the field. Now, I've talked about the deductible with the A and B Medicare, but there's also a part C, and that is if you take one of the Advantage plans. And one of the Advantage plans, you see these all the time, I'm sure, on commercials. Cigna, Blue Cross Blue Shield, Humana, they will offer these Advantage plans. And what they are is that it's a combined plan. So your hospital and your physician, your medical is all combined into one. And then you will just pay like a copay whenever you go to the doctor. And for my particular situation, I have the Advantage plan. And the reason I have the Advantage plan is because when I became eligible for Medicare, I talked with my family physician, which has been my family physician for over 25 years. And she and I talked, and she kind of counseled me on, according to my health and my healthcare needs, what would be the best plan for me. And that's just for me. That doesn't mean it would be the same for you. Now, every time I go to the doctor, I don't have to pay anything if it's just a regular doctor. If I go to the ER, I have a certain amount that I pay. If I go to a specialist, I have a certain amount that I pay. But vision and dental is also included in that. And then a lot of folks don't know this, and even myself, being in social services all these years, I didn't know this until I was just talking to my insurance company it was actually a couple of years ago. I didn't know about the over-the-counter medications that are available now quarterly for people that are on these Advantage plans. And that's something that, you may want to look into as well, because it does come in handy. But be really careful with the Advantage plans, because there's a lot of that you need to consider before going into an Advantage plan. And one, you need to make sure that your doctors and your medical facilities that you normally go to, you need to make sure that they're all in the network, because if they're not, you can get in big trouble. And I've known so many people that have, gone with one of these plans that have actually regretted it, because it can be very costly. Because if you go out of network, you're looking at them only paying 70%, and that's very costly. So that's something to keep in mind. It's something you need to talk with your physician about. And, your medical needs, whatever your medical needs are, that's all real important issues that you need to consider before you agree to go into one of the Advantage plans. And they're not for everybody, but they are very good plans for people that if it meets their medical needs, then they can be very, very good plans. Okay, I said all that to say this. Another thing that you can do is that you can call your area agency on aging. And those numbers are usually or are always toll-free numbers, and it's called Area Agency on Aging. And there are counselors there that can counsel with you and that can tell you the different plans and that can help you get signed up on the Part D and can answer a lot of questions about the Medicare program. So that's something to also consider. Now, I mentioned that you receive Medicare if you're 65 or older or if you're disabled. Now, in my case, because I become very sick in my mid-50s, and I started receiving disability when I was 58. So I wasn't 65. But once that I had been determined disabled for 24 months, then I'll become eligible for Medicare. So remember that, 65 or older, or if you are disabled and have been disabled for at least 24 months and are over the age of 21. Okay, so what I want to talk to you about next is these Medicare premiums are very costly. And, $185, $187 a month, that's a lot of money for people on limited income. And so there are programs with Medicaid that can actually help you pay your Medicare premium. And the first program I want to talk to you a little bit about is called the QMB. And what the QMB will do, if you qualify, and remember this, you have to qualify it's income based, okay? So income and resource based. So you have to pass it with your income criteria and with your resource criteria. Now, if you pass it with your income criteria, but you have $100,000 in the bank, you're not going to qualify, okay? You have to pass it with both income and assets. Remember that. Now, I believe in most states that your home and your car is always excluded from your assets, which is good. All right, so what the QMB is going to do, the QMB is going to pay your Medicare premium, it's going to pay your copays, and it's going to pay your deductibles. That's wonderful, especially for people that are struggling. And a lot of us are struggling. I mean, times are hard sometimes, especially if you're on a limited income. And so it's going to be, so saving that $187 a month, that's a big deal. And then you're not going to be paying your deductible. You're not going to be paying your copays. And so it's a very, very good program, especially for people that have a lot of medical issues. All right. Now, the next program I want to talk to you about is called the SLMB, and it's also a Medicaid program. And you have to be income and resource eligible. So there is an income limit, and these are probably different state to state. I would be reluctant to tell you what it is for my particular state because I'm not real sure if it's the same. But anyway, you can get onto your local state websites and look at these income limits. And but again, you have to pass the income limit qualification and the resource qualification. And what the SLMB does is that it just pays your premium. It's not going to pay any of your deductibles or any of your copays. But hey, $187, that's a lot of money that it can save you a month. Now, you are going to have to apply with your local state. And like I said, from state to state, it's different. Your state might be a whole lot better. It might have a whole lot more resources than my state does. But anyway, I have shared with you several times how that I worked in social services all these years. In addition to the other content that I put out, I do like to help people with, especially in my age group, I like to help them to find resources in their community that can help them, financially, that can help them medically, that can help them mentally. And so anyway, I hope you like this video. I hope you'll hit like and share. And I hope that you'll come and see us on the next video.